Hello, I am Peter Litchfield, and it's a special pleasure, once again, to speak to you on the subject of breathing on behalf of the Shambhala Mountain Center and the Graduate School of Breathing Sciences. This is the second video in a series of 3, where I will present on the subject of dysfunctional breathing habits, with an emphasis on overbreathing and its effects. There will be a 4th video following the series, where I will answer questions submitted by you in regards to the materials in the first 3 videos. I look forward to answering your questions. I'm the president of the Graduate School of Breathing Sciences. We offer an interdisciplinary, web-based Masters of Science degree program in applied breathing sciences for colleagues who are healthcare practitioners, human service professionals, performance consultants, and educators. Should you be interested in this kind of training, please contact us. First, I'd like to present a brief overview of what we did in video 1. This amounts to briefly describing the respiratory equation. Every physiologist, every pulmonary physician, anybody who knows anything about physiology knows of this equation. It has a technical name, but we're calling it the respiratory equation here for your benefit. And it says that pH in body fluids, and in this case I'm going to talk about blood plasma just to make it easier on myself, equals bicarbonate concentration, that's the HCO3 minus, divided by carbon dioxide, partial pressure carbon dioxide. That's the concentration of CO2 in your blood. These bicarbonates are controlled by the kidney, and it takes the kidney many hours or many days to make changes that are significant in the pH level. The CO2 level is controlled by the lungs, and it can be changed from breath to breath. So it becomes the major player in the moment-to-moment regulation of pH. pH regulation is fundamental to health. If pH gets too low, you die. If the pH is too high, you die. There is a very small range in which the pH needs to remain. Blood is slightly alkaline. And if you overventilate, if you reduce this CO2 level here, this pH level will go up, which means that the blood becomes more alkaline. And it can very quickly become too alkaline. And that's what accounts for the symptoms that people report when they call 911. You remember the statistics, the amazing statistics I presented in my last video, where some 60% of the ambulance runs in the large cities in this country are a direct result of symptoms brought on by low levels of CO2. That is dysfunctional breathing, where people are overventilating. That's a pretty amazing statistic. Now, if someone underbreathes and the CO2 level gets higher, then the pH will drop and the blood will become less alkaline. And you'll also get major symptoms as a result. But as I reported to you in my last video, underbreathing is rare. Overbreathing is very, very common. Why that's true, perhaps you'll have a better idea of when we finish this video. So in essence, acid-base balance in body fluids is equal to bicarbonates divided by carbon dioxide. Now, this is normally controlled by reflexes. These reflexes are sensitive to pH, to carbon dioxide levels, and O2 levels. And when these things change, then the breathing changes accordingly. But what happens is that breathing habits, also regulate the CO2. And you can override those reflexes, and you can block those reflexes, interfere with those reflexes, so that regulation of pH is not based on physiological requirements, but is based on the dysfunctional habit that you've learned. So psychology makes a grand entry into physiology through this equation, as you can see. And the effects are dramatic, as we will also see once again shortly. So again, as kind of a recap here, overbreathing means ventilating off too much carbon dioxide. And when you have a carbon dioxide deficiency, that's called hypocapnia. Hypo, too little, capnia, CO2. So hypocapnia is descriptive of carbon dioxide levels in body fluids, like blood. And it's about excessive alkalinity that triggers major symptoms and deficits. Then I went over how to cope with that. If you find yourself in that kind of a situation, it may be because you're not allowing the breath, but you're trying to control it, that you're trying to manipulate the breath. And I talked about being the breath rather than doing the breath. Doing the breath can be a serious problem in restoring good breathing, as we'll see here momentarily. Here are some of the effects of overbreathing that are worth going over here briefly. It compromises, or hypocapnia, overbreathing, compromises oxygen delivery by hemoglobin. It disturbs acid-base balance and makes things too alkaline. As a result of that alkalinity, we see the triggering of emotions, including anxiety, fear, panic, anger, and frustration, and you'll see why on the next slide. It compromises cognition, including memory, learning, and attention. Again, you'll see why on the next slide. It can trigger a wide range of stress symptoms. In fact, every symptom I can think of, including short-term and long-term kinds of symptoms, like fatigue, which is a long-term one, or hyperarousal, which can be a short-term one. It can compromise pulmonary, that is lung function, or cardiac function. It can produce cardiac arrhythmias, muscle pain, muscle dysfunction, nervous system, compromised nervous system function. It can disturb electrolyte balance, that is bicarbonate, sodium, calcium, potassium. It can cause physical symptoms and deficits like muscle spasm and muscle pain and cause dizziness. It can trigger symptoms of existing conditions like it can bring on a panic attack. It can precipitate a seizure. It can bring on asthma symptoms or an asthma attack. It can exacerbate symptoms of existing conditions, that is, make them worse. So if you are asthmatic and you're suffering with asthma symptoms and you start to overbreathe, it will exacerbate those symptoms. Or it can perpetuate symptoms that might have gone away otherwise, might have gone away sooner. Or it can add symptoms to the symptoms that are already there. And it can interfere with all kinds of behaviors like piloting an airplane or public speaking or test taking or operating equipment like playing a musical instrument or acting or all kinds of things. Now here's the kind of thing that happens. A nice little illustration here, a picture of a brain scan looking at oxygen content. The dark blue is where you have the least amount of oxygen content. The red is where the oxygen content is the highest. Then all the other colors are in between. This person was asked to overventilate, and within about 30 seconds, doing moderate overbreathing, just moderate, this person lost about 40% of the oxygen content in the brain because of the constriction of the blood vessels brought on by the alkalinity. So it's not just the oxygen that's been reduced, it's also blood sugar that's been reduced. And so when you reduce blood sugar in the brain so dramatically as this, you can get hypoglycemic symptoms of low blood sugar, like a headache, for example, which can come on very quickly as a function of overbreathing. Okay, and so this is what we're talking about now, is about the habits themselves. And these habits can be learned very quickly and very easily, and they're learned unconsciously. Most habits are learned unconsciously. And these habits, unfortunately, are rarely identified by the practitioner that you might be working with. It probably doesn't even occur to them if the symptoms that they're looking at have anything to do with habits that you've learned. Not only are they rarely identified, but they're almost never really addressed. The symptoms and deficits that are then triggered by this dysfunctional habit are usually labeled as unexplained, or they're mistakenly attributed to other causes. It's blamed on something else. It has nothing to do with the cause at hand. And usually the solutions are about the symptoms, where a psychiatric drug is offered as a solution to a bad breathing habit. Obviously, that's just a band-aid. You're not going to undo a breathing habit by prescribing a psychiatric drug. You need to address the causes, not just the symptoms. And as a consequence, breathing habits and their effects get perpetuated often for a lifetime. I've met many people, older people, who have had dysfunctional breathing problems, producing major symptoms for over 50 years of their lives, only to overcome those problems in the matter of weeks. Why? Because it's a question of identifying the habit, unlearning the habit, and replacing the habit with something that's adaptive. Remember, dysfunctional breathing habits are learned typically unconsciously. Not always, but usually. And it's typical of all habits. For example, the posture now, where you're sitting in your chair, the way I'm moving my hands as I speak to you and shaking my hands, the way I'm looking at you, look at my fingers here. This is learned. Look how I move those two index fingers. And so as I talk, all these gestures were learned. They weren't something I practiced. Look at my shoulders while I'm saying this. I didn't practice this. This is all learned unconsciously. This is the way habits are. Look at my eyes now and my hands. So almost everything about you and all of your physiology it's a huge web of habits that make up your physiology, and breathing is a good example of it. And it's one that profoundly affects you. So in doing a habit analysis, we need to lay out the elements. What are the behaviors that are dysfunctional, like aborting the exhale, like using upper body muscles unnecessarily, or taking the breath rather than allowing it? And then, what are the triggers? Habits are triggered. When you have a bad habit, that doesn't mean you're breathing that way all day long. You may do good breathing most of the time, but you only breathe badly when you're in a certain situation or with a certain person under certain circumstances. Like maybe you're a pilot flying an airplane, and when you get into a situation that's challenging, that's when you start to do it. A good example would be the woman who won the gold medal in ice dancing for Canada some 6 years ago. She had a dysfunctional breathing problem that she worked with her physiotherapist, where when she got on the ice, she would start to overventilate. That was the trigger, getting on the ice and skating. The trigger can be anything. So you have to identify the triggers. You have to identify the symptoms and deficits associated with the habit. You don't ever assume that the symptoms you're looking at are a function of a dysfunctional habit. Even if you know there's a dysfunctional habit, you don't know whether that habit is responsible for those particular symptoms. You need to make the connection between the symptoms and the habit. And you need to look at whether that habit is exacerbating symptoms that may be brought on by something else. You don't want to just assume that because you have asthma and you have asthma symptoms, that therefore the symptoms you have are all because of your asthma. A lot of the symptoms may come about through the dysfunctional habits you have, or may exacerbate those symptoms and make them worse when you do have those asthma symptoms, and so on. And then you need to look at the motivation for the habit. What's motivating you? Is it fear about not getting enough oxygen? Is it apprehension about waiting too long before you take the next breath? What's the motivation? Again, this is usually unconscious. What's the reinforcement? Why do you keep doing this thing over and over, this dysfunctional habit? There's a payoff in there. What's the payoff? What's the reinforcement? Very often, it's all about fear reduction. And you find faulty belief systems about breathing mixed in it, and faulty interpretations of symptoms and things that get mixed up with this that perpetuates the problem. And you need to address the learning history. Where did it come from? How did the person learn this? I know one man who developed this problem because when he was a child, he would wake up in the middle of the night with asthma and couldn't breathe. So in the future, whenever he would lie down, he would start overventilating and get all these symptoms. So it had to do with asthma when he was a child. So a person may have had an injury, a medical condition like asthma, emotional trauma, chronic stress, pregnancy complications, something where they may have learned this habit. And we need to uncover that. We use an instrument in doing this work, so we can tell whether the person really is dysfunctional from a respiratory point of view. Are they really overbreathing? You don't know. I'll show you in my next slide how you really don't know. How do you know? Maybe it looks like the person's overbreathing and they're not. Maybe they look like they're breathing really well, but in fact, they're not. Okay? So you need a way to measure, and we use a capnograph or a capnometer to do that. This is an instrument used by anesthesiologists in surgery. It's used in critical care. It's used in emergency medicine. It's used in ambulances. Those are medical capnometers. We use an educational capnometer, where we use it to identify dysfunctional habits and the triggers that are bringing on the habit. This is a picture of such an instrument that we use. Now, here is the next slide that shows in software here, using that instrument you just saw, somebody's breathing. Now, you notice this graph here. You can see it go up, down, up, down. That's the breathing. But it's CO2 what it's measuring. So down here at the bottom, at the very bottom here, this is the CO2 level in the room. The instrument is measuring the carbon dioxide in the inhale, which is just the room in the air, where there is next to no CO2. So as the person breathes out, it goes up, and it reaches a maximum at the end of the breath. That represents the level of the CO2 in the lungs. And whatever is retained in the lungs is what the blood is going to retain. So you want to retain the right level of CO2 in your lungs at all time, so that the CO2 in the blood is correct, and that equation I showed you is balanced. Now this person is overventilating because these peaks right here are too low. They should be up around 35 minimum, 35 to 45 up here. Ideally, it should be somewhere around 40. This person's down at 25. This is severe overbreathing. But I want you to notice something. This person looks like, on the outside, as an excellent breather. On the inside, they're a terrible breather. On the inside, we're looking at CO2. This is the arterial level of CO2. It's very low. It's seriously low. But from an external point of view, look, this person is breathing rhythmically and evenly all of the time. No gasping, no sighing, nothing like that. Nice and even. And you look down here at the breathing rate. This person is breathing at 6 breaths per minute. That's a meditational level of breathing. That's a yogic level of breathing. Breathing nice and evenly at a constant rate. Nice big breaths. From many people's points of view, they would look at this person and say, now look, we have a perfect breather here. Nice and rhythmic, slow and big breaths. And this person was breathing diaphragmatically. But from an internal perspective, from a respiratory perspective, this person is really dysfunctional and didn't even know it. Now I'm going to give you a case. There are 4 slides here. This is a dysfunctional habit that I describe. There are the habit elements, there's a habit exploration, and there's a habit regulation. And I'm not going to go over the slides. I'm going to leave the slides for you to read on your own. I'll just describe the case. Here's the case. A woman, an athlete, a professional physiotherapist, and a person who had a good life, everything in order except for one thing. She couldn't seem to get enough oxygen. She couldn't get enough air. So she would miss a whole day of work, often maybe 2 days of work every week. And so it was very costly, this problem of not getting enough oxygen where she couldn't go to work. So she went to some physicians who gave her prescriptions for anxiety because they didn't know what to do. It makes sense. I mean, they're not trained in this kind of thing. Why would they know? So they did what they could. They gave her a psychiatric prescription, anxiety prescription, and it did help her, but not her breathing. It helped her feel less anxious about her breathing problem, but it didn't help her with her breathing. She kept missing the same amount of work. And so I talked to her, and here's what happened. I said, well, tell me more. about when this problem shows up. What seems to trigger it? She said, well, there is no trigger. She says, it can happen anytime. It's unpredictable. And I said, well, I don't think that's completely true because you just told me that you miss a whole day of work. He said, what do you mean? I said, well, how can you miss a whole day of work if the problem didn't show up early in the morning? And she said, well, yeah, I guess you're right. I said, okay, so we know it's in the morning, but when in the morning? When you get up out of bed, do you find yourself out of breath and you can't get enough oxygen? She said, no, I'm fine. I said, well, what about when you eat breakfast? Do you have a problem before you start to eat breakfast? She said, no, I eat breakfast. And I said, well, it seems to me that you must have the problem right after breakfast and just before you go to work. And she said, yeah, you're right. I never really focused on it. I never really thought of that. See, this is a habit analysis. Very simple. So I never really thought of that. You know what? Come to think of it, it's happened to me sometimes right after lunch. Maybe it has something to do with eating. And I said, yeah, it seems like it very well could. Let's just keep going and see what we find. So what do? I said, you find yourself, you can't get enough air, you're struggling, you're uncomfortable, you're anxious. What do? Do you call your friends up? Do you go to the gym? What do you do? She says, well, I try to relax. I said, you try to relax. What do you do? She says, well, I sit down, I do some physical kinds of things, and I slow my breathing down, I take nice deep breaths, and but it doesn't do any good. I said, well, so you're that way all day? She says, it's all day. I keep trying from time to time, nothing seems to work. I don't know what to do. And I said, well, apparently it stops at some time. What about dinner? Do you find yourself with the same problem at dinner? She said, no, I feel fine at dinner. And I said, well, something happens where the problem goes away, right? She says, yeah, but I don't know what. I said, what do you do at the end of the day? She says, well, I do my workouts. I said, well, great. What do you do? How do you feel after your workouts? She said, well, I always feel great. Hey, maybe that's what I should do. Every time I have this problem, I should go and do my workout and then go to work. I said, well, that might be the solution, but I think we can probably find a better one. So I then pointed out to her, I said, look, isn't it kind of interesting or kind of strange that you're at home sitting on the sofa and you can't get enough oxygen, but when you're working out at the gym, you can get enough oxygen? Does that seem like a physical problem to you? She said, well, no, it doesn't make any sense. How can I be out of oxygen when I'm doing nothing, and I have plenty of oxygen when I'm doing something? I said, well, let's see if we can find out. So we hooked her up to an instrument, looked at her CO2 level. It was great. Perfect. Up around 40. Great. So how do you feel? Good. I feel good. Getting enough oxygen? Yeah, I feel fine. This is the way I usually feel. I feel fine. I said, well, why don't we try something and do a little exploration with your breathing and see what you find? She said, sure, that sounds like a great idea. So then I said, well, why don't you just sit back and relax? Do you feel relaxed? You feel okay? Yeah, I feel real comfortable with you. I'm real comfortable with you. I feel relaxed. Yeah, sure. So, well, why don't you just try to take a little deeper breaths, just a little deeper? That's good. Okay. The breathing slowed way down. I said, a little deeper, and she's breathing deeper and more slowly, and the CO2 level starts down. And it goes down to about 28, higher than what that individual was you saw in the previous graph. And suddenly she goes, this is exactly what happens to me, she said. This is exactly what happens to me. I'm not going to be able to get out of this for the rest of the day, she said. I said, now, wait a minute. You just got into it. Chances are you can get out of it. Well, I did what you told me to do, she said. And I said, well, what did I tell you to do? She says, well, I said, well, I told you to do what you do when you feel like you can't get enough oxygen. You sit back, you slow your breath down, you take deeper breaths, and if it doesn't work, that's what I asked you to do, right? And what was the result? The symptoms came on, and now you're trapped, and you feel like you can't get out of it the rest of the day. I suppose now you think you ought to go down to the gym, which could be a solution, but I think we can find a better one. I said, let's reverse what we've just done. She said, well, that makes sense. I said, why don't you try it? She couldn't do it. In fact, it got worse and she started to get panicky. So what I had to do is work with her and coach her to make her breath smaller, quieter. So the CO2 level slowly came up. And when it came up, she went, "Gee, I can't believe this." And I said, "Well, what can't you believe?" "I was hardly breathing at all, and the symptoms are gone. It's like taking small breaths and I could get enough oxygen, and taking big breaths I couldn't. I've got something mixed up, something backwards." Okay, so her thought process also paralleled her dysfunctional breathing. They went hand in hand, the way she thought about breathing, her belief system about breathing itself, and about her own symptoms went right along with her habit. So we had to undo those things, undo her belief system, undo her false, kind of misguided interpretation of her symptoms, and help her learn to get out of that place. So I had her, when I coached her out, I had her go back into overbreathing, and she was trapped again. And we had to do it 5 times before she was able to come out of it herself. Now, in her case, she overcame the problem very quickly in straightening out her belief system and learning how to go into the overbreathing and then to come out of it. When she found herself doing it, she knew how to disengage it. Okay, so this was very commonly, these problems are very commonly that simple. However, in many cases, they're not simple. And in some cases, they're really difficult to get to, like people who suffer with trauma, for example, who overbreathe so they can disconnect from their emotions and feelings. This becomes a major challenge to help someone over their overbreathing problem. All right, so what can you do? If you find yourself in a struggle, you start feeling panicky, you feel like maybe you can't get enough air, maybe it's just a breathlessness problem when you worry about things, you feel kind of breathless, or when you feel challenged or stressful in a social situation, you find yourself short of breath, and you know that it's not a medical problem, you know you're a really healthy person, and so on. A couple of things I'm going to pass on to you. First one, finding and trusting the reflex. The second one, quieting your inhale and avoiding big breaths. Always remembering that habits are specific to your learning history, and ultimately the habit elements have to be addressed to really overcome a breathing habit problem, which can be very simple, or it can be quite involved because it may reach into the other problems in your life. So, looking at the inhalation reflex, you understand that it occurs between the exhale and the inhale. And what you want to do is to do some self-exploration. And here's the first step in the self-exploration. You allow the exhale out. Okay? Don't force it. You watch it go out. And when it ends, is there an interval? Is there a transition time? When it stops, does it stop for a quarter of a second, a half a second, or is there an instant breath? If there's an instant breath, there's probably some kind of dysfunctional habit involved. How can you tell? Watch the breath go out. Notice how you feel near the end of the breath. Do you feel any apprehension, any kind of anxiety, air hunger as the breath is finishing? And then if you keep the breath out a little bit, force a little bit of transition, the breath goes out, hold the breath out. You haven't pushed it out, just leave it out, even though you want to take a breath, and see how you feel in that little fraction of a second. If you have a little bit of anxiety or apprehension in there, that's enough motivation for you to unconsciously reach for the next breath and to block the reflex, that you take the breath rather than the reflex occurring. That little tiny bit of apprehension right there. And it pays off for you because the apprehension is gone. Every time you take that breath, the apprehension is gone. Meanwhile, the reflex is left out in left field someplace and isn't operating. You're stepping in and taking over. So, you need to find the reflex so you can develop a confidence in it. How do you find it? I'm just going to tell you a little bit about it here. You essentially want to allow the transition time to be out for a second or so, and in that second look for kind of a physical jerk or a sense of urgency or a desire, a thought, even a visual image, depends on the person as to what they find. If you can't find it, lengthen the transition time. Bring it out to maybe 2 seconds and wait to see if you can find a sign of it. And when you can identify it, really learn what it feels like so that you can tell when you're not allowing for it, okay? And so the next step is you need to develop a trust. Develop a trust. You need to allow the reflex. And here's one way you can do that. You can desensitize yourself to the interval by extending the interval, the transition time. So you breathe out, allow the breath out, do a count of 2 and 1 and 2, allow the breath, do that 3 or 4 times, breathe normally. Once you've been doing that and you're kind of bored with that, then go to 5 seconds. So the breath goes out, you just leave it out, don't allow the inhale to come for a count of 5, then allow the inhale to come. Then breathe normally for a little bit, do 5 seconds again, breathe normally, 5 seconds again. Then try 10 seconds. Breath goes out, do a count of 10, allow the breath in, breathe normally, and so on until it becomes easy. So 2 seconds seems like nothing, and there's no air hunger, there's no apprehension, there's no anxiety. And in addition to that, during the 10-second intervals, or if you do it longer, 15 or 20 seconds, try to visualize something really, really positive so that zone, that transition gets associated with thinking about something positive. The idea is to develop a preference for allowing the breath rather than taking the breath, because it's easier just to allow it. You don't have to keep track of it. You just let it go on its own, and it becomes self-reinforcing over a period of time. But you need to develop that preference, so you prefer to allow it rather than take the breath. Make that space, that transition, a place of meditation, of solitude. Then, finally, quieting the inhale. Learn over a period of time through observation to minimize the inhale. So when the inhale comes, notice if you're assisting it. If you're assisting it, you know you're taking too much air. Okay, so the idea is to start, if you find yourself assisting it, then what you want to do is to start to make the inhale a little smaller. I mean, just a tad smaller. A little smaller, breathe that way for a while, you're comfortable, then a tad smaller, and see how minimal you can actually make the breath, and surprise yourself as to how little you need to breathe to feel really comfortable and relaxed. And that will become preferable. If that works, then you'll prefer that over constantly reaching for air because you think you can't get enough. Remember, large breaths can get you into a lot of trouble. It can lead to an unbalanced chemistry and the symptoms and deficits associated with it that you may be attributing to something other than your breathing. The next video that we're going to do soon is we're going to talk about intuitive learning and prescriptive intervention. Many of the breathing techniques you see out there are things you impose on yourself, that you breathe a certain way on purpose. It's called outside-in control, and it may by accident address your breathing habit, but it probably won't. Intuitive learning is experiential exploration. It's inside out. It's about your experience. It's about reconfiguring your own breathing personality. That's what it's about. So you breathe differently. You don't have to impose the right breathing. You just do it because it's part of who you are. Now, if you think you might have a dysfunctional habit, here are some actions you can take. Come to our workshop, the Shambhala and the Breathing Science workshop. Learn more about it. But don't come to the workshop just for that. If you're interested in breathing and really learning about breathing science, come and take the workshop. If you're interested in peak performance training and maximizing cognitive ability and so on, come to our workshop and learn something more about it. Also, if you're interested, fill out the checklist that's in the email that Shambhala sent out and send it to this email address, and we'll contact you for a consultation session. And you can do that before the workshop, during the workshop, after the workshop, whatever you want to do. But please feel free to contact us. And lastly, if you have a professional interest in being a breathing practitioner, maybe you're a physiotherapist, maybe you're a physician, maybe you're a psychologist, maybe you're a breath worker, maybe you're an athletic coach, whatever it is, and you're interested in breathing in a serious way, think about our master's program. Look forward to hearing from you and look forward to presenting the next video. Thank you very much. Goodbye for now.